will be happening. So do we have to wait 25 days or 1 month more compared to that of a patient in which we have placed the implant with a D1 bone? Because the stability will a little bit be later in D3, D4 type of bone. Is it
Hmm.
such that?
Uh, yes and no. Yes,
Okay.
because implant stability is a factor of the quality of the bone. So yes, we should try to avoid primary loading. Sorry, we should try to avoid immediate loading in a case which is having very porous bone. Okay, and we should delay the loading to about 2 to 3 months, not 1 month. 1 month में osteoblast start होता है. Okay, फिर वो थोड़ी देर चलता है. ओके एंड फिर उसका काम कंप्लीट नहीं होता है, वो तो पूरा टाइम चलता रहता है. ऑस्टोब्लास्ट ऑस्टोक्लास्ट चलता ही रहता है, लिविंग है ना. सो वो
Hmm.
जैसे जैसे प्रेशर आता है इम्प्लांट के ऊपर, खाना खाते हैं तो अभी भी हमारे माउथ में भी चल रहा है वो ऑस्टोक्लास्ट ऑस्टोब्लास्ट रिजॉर्प्शन. बट उसका एक लैमेलर पैटर्न बनना स्टार्ट होता है 2 मंथ्स पे. तो 2 मंथ्स पे वी विल स्टार्ट लोडिंग. सो हम इमीडिएट इम्प्लांट कर सकते हैं बट इमीडिएट लोडिंग टूथ प्रॉमिस नहीं करेंगे पेशेंट को, ऐसे पेशेंट्स में जहां पे बोन क्वालिटी ऑलरेडी वीक है.
Okay. I mean to say, we wait for 3 months, right, for the to go ahead with the second stage, gingival former, ideally.
नहीं, वो काफी पुराना हो गया वो. अभी 3 मंथ्स तक वेट करने की बहुत ज्यादा जरूरत
जरूरत
नहीं
नहीं है.
है. आई विल टेल
ओके.
यू कि क्यों नहीं करने की जरूरत है. आई टेल यू दिस. हाँ, अभी करते हैं वो स्टार्ट. चल, ग्रेट, गुड क्वेश्चन, थैंक यू. तो लेट्स नाउ डेल्व इनटू द एग्जैक्ट things which we want to learn about the implants. So everybody can see my screen.
Yes, sir.
Yes, okay. So dental implants, I won't go much into the history, theory and academically what is important and तो PG seminars में हम पढ़ते थे. I'll very quickly brief you कि कौन से टाइप के implants होते हैं और हमारे लिए क्या relevant है. So there are three types of basic dental implants which are present in the world. One is called as endosseous, then is subperiosteal, and then is transosteal. Now, endosseous is something which means that inside the bone we have drilled and we have placed within the two buccal and lingual cortices of the bone. Okay, any implant, any shape, any character, any color, any material, if we have placed within these two cortices, buccal cortex and lingual cortex के बीच में अगर डाला है, that is known as endosseous implant. Okay, within the osseous. If any implant is stuck on either of the cortices outside, it doesn't go inside, it just stucks outside, it is known as subperiosteal. Why subperiosteal? Because we have raised the flap and periosteum जो bone के ऊपर चिपका हुआ रहता है, that comes into the flap. Okay, and then the implant is fitted. So ये जब flap वापस आता है ना, सो इम्प्लांट क्या हो गया, वो जो इम्प्लांट का स्ट्रक्चर है वो पेरियोस्टियम के अंदर हो गया. सो दैट इज नोन एज सब पेरियोस्टियल, इनसाइड द पेरियोस्टियम, सब पेरियोस्टियल. ओके, these kind of implants don't go inside their body. The main structure of the implant is not inside the implant, inside the bone. It is on the cortical plate या जो साइड का जो बेसल बोन का कॉम्पैक्ट लेयर है यहाँ पे है. ओके, एंड देन देर आर ट्रांसऑस्टियल इम्प्लांट्स जो बेसिकली बोन से में एंटर करते हैं और फिर बोन से बाहर भी निकल जाते हैं. सो मेनली इन द मैंडिबल. सो इट वी इंसर्ट इट फ्रॉम टॉप एंड देन वी कम आउट एंड फिर यहां से भी एक इंसर्शन करते हैं एंड देन वी टाइटन इट. ओके, सो दिस लुक्स वेरी क्रूड, इसलिए ये कभी नहीं करते, ये अब होता नहीं है. बट जस्ट फॉर द सेक ऑफ थ्योरी कि देर आर दीज थ्री टाइप्स ऑफ इम्प्लांट्स which were done, which were introduced over the years of time. 1 minute. 1 minute, I'll have to share again, some issue. हाँ, Okay. Now see, this is something like a subperiosteal implant where the bone main part of the implant, the structure is outside the bone, inside the periosteal layer, and it is fixed with some screws like the bone plating and screws which are used by oral maxillofacial surgeons to heal the fractures. वैसा ही वो एक फ्रैक्चर के लिए जैसे लगाते हैं प्लेट, वैसा प्लेट, and then it has this extension to provide the teeth. So this is subperiosteal implant. This is also subperiosteal implant in the maxilla. So the main structure is outside the bone on the compact bone, and it is fixed with these screws. Now these have suddenly become very popular nowadays, but not very successful. They have become popular because ऑस्टियो इंटीग्रेशन के लिए बोन होना बहुत जरूरी है एंड मेनी ऑफ द पेशेंट्स हु आर कमिंग विद एट्रोफिक मैक्सिला एंड एट्रोफिक मैंडिबल पेशेंट्स हु आर हैविंग दिस black fungus disease which is mucormycosis or radiation patients or any patients where hemimandibulectomy or this mandible maxillary resection is done, those patients don't have any alveolar bone, sometimes they don't even have the basal bone. So there we attach these plates to the nasal cortical area, we attach these plates to the zygomatic area, and we can actually, because 3D printing and milling of titanium has become so nice and digital technology has become so nice, we can actually make these implants customized to the patient's bone. So a CT scan of the patient is taken, and then the CT scan is loaded into a software, then this designing is of the implant is done just how we design our crowns in the lab. ऐसे exocad पे या किसी सॉफ्टवेयर पे ऐसे डिजाइन करते हैं, और डिजाइन करने के बाद this is sent to milling or printing, and then they are printed in titanium, and then on the surgical day they are opened and then they are placed. Okay. Yeah, so the clinical picture of any subperiosteal implants look like this. Though they are not very good in function, because the flap always keeps tearing off. There is a lot of dehiscence of the flap. There is a lot of recession. There is no osseointegration, obviously, because the implant is not going inside the bone. It's just fixated on top of the bone like screws. We don't know the long-term effects of this. So we try to prevent all these heroic stuff, something like this in the maxilla. Okay, so this is for your understanding a subperiosteal implant. Very, very tricky thing to do. I have assisted one case with Dr. Vijay for doing this subperiosteal implant in a mucormycosis case very, very many years back, 6, 7 years back. So like this, yeah. So this is the problem which happens. There is a lot of gap, there is a lot of tissue shrinkage. Okay, then we have the transosteal implants, which are basically like they have a plate, and the plate is fixed to the lower jawbone, and on top of it the denture is fixed. It goes through and through the bone. Okay, mainly valid for the mandible. But what we want to, this is the X-ray taken from one Dr. Kale in Pune, who has done this case 25 years ago. Okay. Now, endosseous implant is what we actually want to talk about, because that's what we will do. Endosseous implants mein there is one implant which used to come, which was known as a blade type of implant. Okay, this is also a type of endosseous implant. ऐसे दिखता है. Sometimes these patients come to our OPD with, because they like older patients who are like above 60, 70, and they were experimented on by some dentists in foreign, in some country where they have done this. Now it is not used again because of obvious reasons. They can be made up of titanium, can be made of different alloys also. They also did their job well, but very technique sensitive. And nowadays we have come to some implants which are looking more closer to the natural root. Okay. Who is Sia Art Theatre?
So it's me, Sanya.
Okay, okay, hi. Okay, hi. Come. ठीक है. So what we are discussing is about the type of implants. So this implant, blade type. Now as you see from the start, we started with this subperiosteal type. Can you see slowly the implants, the teeth, everything is turning into biomimetic. We are trying to mimic nature. So we are trying to come close to how nature works, and that's why all these older implants are vanishing and we are coming more closer to nature. So this was like more of a cylinder, press fit cylinder. This is a cylinder which is having some rough surface. And then finally we come to the newer age implants which we do nowadays, which are known as root form end osseous screw shaped implants. Okay, the implant design which we use nowadays is root form because it is slightly like the apex is narrow, the top portion is wider, so it is screw shaped conical, and it is having a screw shape because it has these threads, and it is end osseous, it goes inside the bone. Now in screw shape also, still we have to understand what are the different types. So now I will start my discussion on ये इतने सारे कंपनीज है क्या. आप में से कोई अगर WDS जा रहा है आज, या अभी आप जाके आगे फैमडेंट अटेंड करोगे, आईसोए अटेंड करोगे, कोई भी कॉन्फ्रेंस अटेंड करोगे, so you will see so many stalls with so many different implants in them. So you should be able to identify okay, how this will perform, what I should buy, what I should. So that's why this course is not specific to one company. I'm not going to talk ke Ostem अच्छा है, not going to talk ke Straumann अच्छा है, ke Norris अच्छा है. Every implant company is good. They do their best work. They provide implants in the price point which our population needs. एंड हर एक जैसे हर एक पेशेंट के लिए एक डेंटिस्ट होता है, वैसे हर एक डेंटिस्ट के लिए एक इम्प्लांट होता है, वैसे हर एक बोन के लिए एक इम्प्लांट होता है. सो विल स्टडी ऑल द डिफरेंट फैक्टर्स. So we have basically two types of implants which we study in end osseous screw shaped root form, something known as one piece and two piece. Okay, so let's understand the design of the implant. We will show you these type of implants also in the clinic, but एक थोड़ा एक what I should say terminology अगर हमें पता चल जाए अभी इस लेक्चर के थ्रू, then we'll be able to come to one single page by 22nd of November where we will meet and we can actually talk थोड़ा better level से हम start कर सकते हैं. So this is the implant actual which goes inside the bone in a two-piece structure. Then there is an abutment, okay, and then there is the crown. This is a part of the implant. Now some very smart people in the world thought कि ये तीन चीजें क्यों होनी चाहिए, लेट्स मेक इट जस्ट टू थिंग्स. जैसे आपके बॉन्डिंग के सिस्टम्स में एडहेसिव्स में एडवांटेज आता गया, एडवांसेस आते गए. सो व्हाट हैपेंड, देयर वर थ्री बॉटल सिस्टम्स. वी यूज्ड टू हैव एचेंट, वी यूज्ड टू हैव प्राइमर, देन वी यूज्ड टू हैव टू स्टेज प्राइमर्स, वन इज हाइड्रोफिलिक, वन इज हाइड्रोफोबिक, एंड देन वी यूज्ड टू हैव द एडहेसिव. अब क्या हो गया, इट्स वन सिंगल बॉटल जिसमें एचेंट भी होता है, प्राइमर भी होता है, एडहेसिव भी होता है. सो यू जस्ट अप्लाई दैट एंड यू आर डन. तो वैसे ही सम वेरी स्मार्ट पीपल थॉट के व्हाई नॉट हैव abutment and implant together. Okay, so that is basically known as the one piece implant. One piece का मतलब है the part which goes inside the bone and the part which lies outside the bone in the gums and in the oral cavity, okay, is one single piece. There are no two pieces which are separate. तो इससे क्या होगा, the inventory is reduced. ये abutment लाओ, वो abutment लाओ, इस कंपनी का नहीं है, उसका वो झंझट खत्म हो गया. the it is much more stable, less chances of fracture because अब because इसके अंदर कुछ नहीं जाता है, there is no additional part which is to be screwed into this, so this part of the implant is not hollow, it is solid. Okay, so it is more fracture resistant and it can be, because it is not hollow, इस screw के अंदर एक space नहीं है, इसलिए it can be made smaller, like it can be made thinner. So that's why you will find all your implants less than 3 millimeters in diameter, only of one piece. Okay, if you have an implant of 2.5 millimeter which is of two piece, never buy that, because एक पतला सा 2.5 millimeter का screw उसके अंदर भी hole किया होगा two piece बनाने के लिए, 101% it is going to fracture. Okay, so these are the type of implants which are available. They have very some specific uses, जैसे कि you can use them for putting over dentures, जहाँ पे we want to just give some stability to the denture which the patient is wearing. So just put these 4 or 5 of these in the lower jaw, and then you can make the holes in the denture and you can put the retention caps so that the patient gets added retention. This is a wonderful way to add retention to a loose denture. It can also be used as a transitional implant. So imagine, as Dr. Dhruvin was telling us, that T3 D4 bone का patient है and you have put the implants but you feel कि नहीं primary stability तो इतना अच्छा है नहीं, but the patient wants to eat food and wants something and it's a full arch case. So आपने 6 इम्प्लांट डाल दिए हैं बट आपको लग नहीं रहा है कि इतना कॉन्फिडेंस नहीं फील हो रहा है कि स्टेबिलिटी अच्छा नहीं, आई डोंट वांट टू पुट प्रेशर ऑन माय ओरिजिनल इम्प्लांट्स. सो व्हाट यू कैन डू इज ऐसे 4 एक्स्ट्रा इधर थोड़े थोड़े डाल दो in between the actual real implants which you are going to use for long term. ये 4 बहुत इनएक्सपेंसिव आते हैं, इनको एज अ टेम्पररी इम्प्लांट डाल दो एंड इसके ऊपर टीथ दे दो, जो एक्चुअल इम्प्लांट्स हैं उनको सबमर्ज कर दो. तो क्या होगा, पेशेंट्स विल गेट दैट इमीडिएट लोडिंग पॉसिबल, इमीडिएटली वो डेंचर एटलीस्ट वो रिटेंशन रहेगा, डेंचर स्टेबल रहेगा. यू कैन हैव द डेंचर टिल दे आर अंडरगोइंग द हीलिंग फेज एंड फिर 2 months के बाद इनको निकाल दो, दे कैन बी टेकन आउट. और इफ दे हैव फ्यूज्ड, let them fuse, no problem, you can use them as the final this thing. You don't have to worry ke fail ho gaye to main kya karunga. You have these other implants which would have got their secondary stability by then, and then you can start loading them properly. Okay, so was this concept clear to everybody, the one piece implants?
Yes, doctor.
Yes.
Okay, now we come to two piece implants. Okay, इसका एक structure एक बार हम समझते हैं अच्छे से. Now, two piece implants have what compared to a single one piece implant? They have two pieces. One, the abutment is a separate portion. The implant which goes inside the bone is a separate portion. So this comes in a separate packet. इसका कुछ size होगा, and this comes in a second package. इसका भी कुछ size होगा. So inventory is double. Okay, but when the inventory is double, it means options are also double. तो हर पेशेंट के लिए हम कस्टमाइज कर सकते हैं. Do we want to have a thinner abutment, wider abutment? Do we want to have longer abutment, shorter abutment? Do we want to have abutment which is hexed, which is non-hexed? ये सब हम चेंज कर सकते हैं. मिनी इम्प्लांट्स में या वन पीस इम्प्लांट में हम एबटमेंट लेवल पे ज्यादा चेंजेस नहीं कर सकते. विल आइदर हैव वन लाइक इसका 3 mm होगा, 5 mm होगा, 7 mm होगा, या ये बीच में छोटा सा पार्ट है ये भी 1 mm, 2 mm, 3 mm होगा. इससे ज्यादा कुछ चेंज नहीं कर सकते, अदरवाइज ये भी पूरा चेंज हो जाएगा, राइट? But in two piece we have a lot of variations. Nowadays in most of our practices we want to give customized solution to the patient. That's why we use two piece implants. One piece में structure if failure होता है, अगर ये ऊपर का पार्ट जो थिन है ये टूट जाता है, then what do? You can't do anything with them. It's a useless implant. आपका वो साइट वेस्ट हो गया. ओके, सो इमेजिन इफ यू प्लेस्ड इन 1-1 एंड आपने ये इम्प्लांट लगा दिया और उसके ऊपर आपने क्राउन लगा दिया. इमेजिन आफ्टर 5 years ये ही टूट गया, तो अब इम्प्लांट तो इंटीग्रेट हो गया है, अब आप इसको निकालोगे कैसे? ये होल्डर ही टूट गया, ये अबटमेंट टूट गया, अच्छा नया क्राउन कैसे दोगे? नहीं दे पाओगे ना, दैट्स अ प्रॉब्लम. सो लॉन्ग टर्म के लिए दीज इम्प्लांट्स आर नॉट वेरी स्टेबल अनलेस एंड until you are doing some overdenture or something. Okay, so we don't prefer these implants. We prefer abutments with two pieces because we can customize. and अगर abutment लूज हो जाता है, टूट जाता है, इम्प्लांट में कुछ हो जाता है, इंटरनल कुछ ब्रेक हो जाता है, वी कैन ऑलवेज रिमूव दिस abutment, ऑर्डर अ न्यू abutment एंड प्लेस इट. ठीक है. Now in two piece implants we have two different type of implants which are available. One are known as bone level implants, one is known as tissue level implants. Now इसके पहले I'll explain you parts क्या होते हैं implants के. तो implants में if you see very clearly we have this rougher surface which is from top and till the apical zone. So इसमें threads होते हैं and it is little rough also. And then there is a slight collar एकदम top पे most of the implants में. Sometimes some implant companies what do? They make this collar very large. So वो क्या करते हैं, ये collar को इसके जैसा बनाते हैं. Of what? A two piece implant having a polished collar. So these polished collars which are available, these polished collars are to be put in such a manner that this polished collar touches the gums and rough part of the implant goes inside the bone. So this is known as a tissue level implant, which means कि जब हम implant planning करते हैं, जब हम implant डालते हैं, तो हम ये consider करके डालेंगे कि कुछ part of the implant will remain outside the bone, which is a polished part, जिसके ऊपर gums attach होगा, and कुछ part जो rough है वो bone के अंदर जाएगा. Got it? And इसके ऊपर फिर abutment आएगा. दूसरा एक part होता है implant का, which is a bone level implant. So bone level implant are supposed to be placed at the level of the crest of the bone. ओके, सो यहाँ पे जो सॉफ्ट टिश्यू वाला पार्ट है दैट डज नॉट गेट अटैच टू द बॉडी ऑफ द इम्प्लांट, इट अटैचेस टू द एबटमेंट ऑफ द इम्प्लांट। जो एबटमेंट ऊपर से आएगा उसके ऊपर ये गम्स अटैच होंगे, ना कि इम्प्लांट के बॉडी के ऊपर। ओके, नाउ देर आर सर्टन एडवांटेजेस एंड सर्टन डिसएडवांटेजेस ऑफ यूजिंग अ बोन लेवल एंड अ टिश्यू लेवल इम्प्लांट। बोन लेवल इम्प्लांट का एडवांटेज ये है कि वी कैन प्लेस इट डीपर and we can attach whatever kind of abutment we want to put. We can modify this part of gingiva to make it look more aesthetic. That's why these are preferred in the anterior region. In the anterior region, wherever aesthetics is concerned, we try not to place a tissue level implant unless and until there is severe bone loss. Okay, we prefer to place only this one. We place in the back region, in the posterior region, tissue level implants because we want more implant stability. We don't want these implants, this part of the implant to come out and put again and again. So imagine when you are putting something on top like a crown और उसको चेंज करना पड़ा बार बार, या एबटमेंट लगा रहे हैं उसको चेंज करना पड़ा बार बार, वी आर एक्चुअली नॉट disturbing this attachment also. So advantage of tissue level is that we are always preserving this gum tissue attachment to the implant. We don't have to disrupt it again and again. But whenever in a bone level implant, we are removing the abutment and we are placing the abutment, we are removing the former, we are placing the former, we are removing the crown, placing the crown. Every time this attachment to the abutment which would have formed is disrupted. तो हर बार ये disrupt होता है, हर बार हम नया introduce करते हैं. तो any of you who are placing implants or may have placed implants, you may have witnessed कि जब आप former tight करते हो तो former tight करने के बाद patient को pain होता है. It's because the gum tissue is getting displaced and it is coming back. It's coming displaced and coming back. Imagine every time you are putting cord when you are doing tooth prep. तो उसमें भी क्या होता है, वी आर डिस्प्लेसिंग द जिंजाइवा एंड देन वी आर टेकिंग आउट द कॉर्ड. सो सम चेंजेस इन द जिंजाइवा वी सी. समटाइम्स वी सी जिंजाइवल रिसेशन ऑल्सो. अगर ज्यादा जोर से हमने टूथ प्रेप करने के बाद ज्यादा जोर से हमने कॉर्ड लगा दिया तो गम्स आर वेरी वेरी सेंसिटिव. सो इमीडिएटली व्हेन वी रिमूव एंड व्हेन द पेशेंट कम्स बैक टू अस फॉर अ क्राउन, वो टिश्यू वो कॉर्ड की वजह से रिसेशन थोड़ा सा हो जाता है. सो दैट इज बिकॉज वी आर many times disrupting the gingiva, which we want to prevent. That's why tissue level implants were introduced. Now, one more advantage is there of tissue level implants to the bone level implant is कि जो भी components हैं they are always placed at the top layer. मतलब यहाँ पे end हो रहा है, right? So when they are ending over here, this surface and this surface having a distance, a gap. So whatever bacteria gets collected because of the connection, जो बीच में एक connection बनेगा इन दोनों के बीच में, abutment and implant के बीच में, वो bone से बहुत दूर है. So what happens, any bacteria if it goes inside this connection, it is far from the bone. So bone levels are better preserved. Bone levels are better preserved meaning bone crest ज़्यादा resorb नहीं होती है over a period of time in tissue level implants. This is what the research says. That's why many of my cases I prefer to place tissue level implants in the posterior region also because we don't want to disrupt this connection again and again. Now there are very few companies which make tissue level implants because planning and execution of tissue level implants is slightly difficult. Okay, because you have to take into account the thickness of the gingiva also plus the thickness of the bone above the canal or above the sinus to calculate your total length, right? So if your bone length is 10 mm and if you place a 10 mm implant, what will happen? This tissue level part will get stuck, okay, and the implant will not go more inside. So there will be a 2 mm of space here. So you will actually would have placed only a 8 mm in the bone. ये पूरा अंदर ही नहीं जाएगा. So there you actually have to order a 12 mm implant or a 13 mm implant depending on the thickness of the gingiva and the actual length of the bone to calculate the total dimension of the implant. So it makes the planning a little more complicated. थोड़ा समझना, थोड़ा ये part change नहीं हो सकता है. So aesthetically it can turn out bad. What can happen? थोड़ा सा recession हो सकता है. So when the recession occurs in the anterior region and you have placed a smooth surface implant which is slightly outside the bone, so this metal collar can be seen and that is very unaesthetic. That is a failure, aesthetic failure. So patients may not accept that. So that is a challenge again. That's why a little complicated. So so we prefer most of the times doing bone level implants, which are much safer. Huh? There is a problem of the abutment getting removed again and again, because when we remove the abutment, this transgingival component again comes out and the gingiva का जो seal है वो बार बार break होता है और bacteria can deposit close to the bone. So when we place the implant and the abutment on top of it, abutment और implant का जो connection है, it is more closer to the crest of the bone. So bacteria can leach into it. So that is the disadvantage. Obviously, there will be some advantage, some disadvantage. So we will carefully select our cases where we can, and we will do our implant dentistry based on that. Okay. Let me take a break here and ask everybody is clear with this concept of tissue level and bone level?
Sir,
Yes.
what do we do after tissue level implant placement? Do we place only a cover screw, no formers later on also?
Ma'am, it can depend on the thickness of the gingiva.
Okay.
Okay. The thickness of the gingiva is 4 mm, but thickness of this tissue collar is not available in any implant of 4 mm. It is around 2.5 mm.
Okay.
Okay, so if you placed it and 2.5 mm का वो टिश्यू लेवल है, उसके बाद भी अगर आपका वो जिंजाइवा क्लोज हो रहा है ना ऊपर से, then you will need to do a second stage for these also.
Okay.
Okay, but sometimes the tissue space is less, so you will not need.
Okay.
Yes, very, very valid question. Anything else? Think if you have any questions, just ask me about two piece or bone level and tissue level. Okay, let's move forward. Huh? So now we come to how the implant actually looks like. So every implant will have a macro geometry and a micro geometry. Macro geometry is nothing but the actual shape of that screw. के उसका वो जैसे rotary files में होता है ना, we have this helix angle, we have the reverse curve, S curve. Same we have in implants. We have different kinds of threads. We have different kinds of structure. उसका angle ये थोड़े बाहर जो main body of the implant है, which is the internal part, that can be narrow or wide. The threads with the fins which are coming outside the implant body can be more wider or can be more narrower. These all things are done just to enhance the bone implant contact, just to enhance the osseointegration. And when I'm using the term osseointegration, always will pay my respects to Dr. Brennemark, who is the founder of this science, which is osseointegration. Now, what implant he designed was a very parallel surface design. So as you can see, it is a root form, but it is not conical. It does not have a apex which is narrower and a base which is larger. It is the same parallel surface. It has some screws, and again it has a little bit of a projection outside. Okay, so let's see what this projection is all about, and this is our last topic of the day. Okay, so when we do the osseointegration, when we study about the implant structure, we study about this part also, which is something which goes inside here, which is a hollow part. Okay, now this part which is going to attach the abutment in a two-piece implant. So one piece में तो ये फंडा है ही नहीं. One piece is what? It's the abutment which is going to fix the crown is actually one part of the implant itself. So it is not hollow, it is solid. उसमें कुछ है ही नहीं, टाइप आता ही नहीं है. लेकिन lot of implant companies came up with their own designs when they wanted to fix the abutment inside the implant. So abutment basically goes inside this hollow chamber. Okay, जो original Brennemark ने बनाया था, that part जो two piece का abutment part है, that used to sit on top of this implant. It did not used to go inside the implant. Okay, so this area is actually a supporter for the abutment to fit on. This is known as external attachment. Okay, because it is outside the implant body. So there is an implant और उसके ऊपर एक छोटा सा एक attachment लगा दिया है जिसके ऊपर abutment आके lock होता है. So this is known as external attachment. Now external attachment hex के रूप में है. Hex का मतलब है it has 6 sides. So that's why these implants came to be known as external hex implants. Okay, external hex implants, because this have 6 sides. So you have 6 directions where this implant connection can fit the abutment. So there is an abutment, there is the implant, it can fit in 6 orientations. So that's why it is known as hex or hexagonal. And because it is above the implant surface, the abutment is not going inside like a cone. जैसे दो आइसक्रीम कोन स्टैक करते हैं एक दूसरे के ऊपर, वैसा नहीं है. It is just fitting on top. So that is a external hex. Now we have the other side, which is the external hex, where the abutment goes inside the implant. Okay, so here the implant has to be a little hollow from inside, like this. एंड इस एक बड़े कोन के अंदर एक छोटा कोन और फिट हो रहा है, विच इज द एबटमेंट. अगेन दिस कनेक्शन विल हैव मेनी टाइप्स. सो दिस विल हैव internal. Now this whole thing become internal because the abutment is going inside. So it is known as internal connection. And internal connection में we have so many different features or variations. जैसे कि hex हो सकता है. Hex means it has 6 sides. जैसे कि ट्राई चैनल हो सकता है, मींस इट हैज 3 साइड्स. जैसे कि ऑक्टागोनल हो सकता है, मतलब इट हैज 8 साइड्स. और उसके बाद ये सारे ऑक्टागोनल हो, हेक्स हो, स्टार शेप्ड हो, इंटरनल हेक्स हो या कॉनिकल हो, ये थोड़े डीप हो सकते हैं या ये थोड़े शैलो हो सकते हैं. सो इट कैन बी शैलो इंटरनल हेक्स और इट कैन बी डीप इंटरनल हेक्स. सो इफ आई एम जस्ट गोइंग टू जूम ऑन दिस, आई विल ट्राई टू जूम इन. Can you see this zoomed in a little bit? This area? Just try to observe these lines. The red line, this is the red line. This is the external hex implant where the abutment is sitting on top of the implant surface. It is not going inside. Only the screw is going inside, which is locking the abutment and the implant. The abutment is actually only fusing on the implant on the external side. So this is the external hex. जो attachment abutment को fit करती है वो implant के ऊपर है, अंदर नहीं है. So this red line is where this attachment ends. Now this green line, can you see the abutment is going this much inside the implant. So this is the shallow internal hex or shallow hex or shallow internal component implants. Okay, and then you have one blue line. This is the third implant where the abutment is going more deeper. So as deep it goes, better it will lock, right? As deep it goes, more stable will be that connection, right? So this is more internal, this is deep internal hex or deep conical implants. Okay, so these are the 3 different type of connections which are available in the world today. When you go to WDS or Famdent today or whenever this happens in the conference, you should go and check the implant इसके अंदर कौन सा connection use किया हुआ है, and they should ask your medical representative के what kind of connection is there and what is the advantage of that. That's your homework. Okay, so this external hex implants are seldomly used nowadays. They are less favored because internal hex में या internal connection में there is more stability. Obviously when the cone is actually meeting another cone, it is more going deeper inside, it is more stable. But there are some advantages of external hex. Now basically I'll tell you, जब cone के अंदर जाता है, the fit is better. Okay, the fitting without even putting the screw, sometimes the fit is better. That's how the ice cream cones are stacked on top of each other. They go inside, they lock. ज्यादा हिलता नहीं है, वो फ्रिक्शन से ही लॉक हो जाता है बहुत बार. सो स्क्रू लूजनिंग का चांस कम होता है. एक बार आपने कैप लगा दिया, एक बार आपने इम्प्लांट के ऊपर लगा दिया, सो स्क्रू जल्दी लूज नहीं होता है. इट इज मोर स्टर्डीली फिटिंग बिकॉज द कनेक्शन इज डीपर. एक्सटर्नल हेक्स इम्प्लांट्स में क्या होता है, द स्क्रू गेट्स लूजनड अप वेरी क्विकली बिकॉज ये इम्प्लांट और एबटमेंट का जो कनेक्शन है दैट इज वेरी सुपरफिशियल, इट इज नॉट गोइंग डीप इनसाइड. So that's why external hex implants are not used in single tooth cases or very seldomly used in single tooth cases. If there are multiple implants in one jaw, 4 5 implants hai, we want to use external hex than internal hex because external hex में एक advantage है, it makes the prosthesis design, components, execution much more easier because वो ज़्यादा जाके lock नहीं होता है, वो superficial attachment है, so it is more easier to remove and take it out, much more easier to build the crown from the top itself rather than from the internal area. Okay, but when we are doing a single tooth case or maybe a maximum 2 teeth case like a bridge case, we want to do a connection which is deeper so that screw loosening is not happening again and again. And इसका disadvantage क्या है, that this makes the assembly of implant and abutment so tight or so rigid, so it's so good in contact that there can be very activated fitting of the surfaces. For example, if you have one, that is okay, but if you have 2 or 3 implants and इसमें से किसी एक का भी एंगल थोड़ा ऐसे है, then going inside and engaging this properly will make life hell for you because passive नहीं framework होता है, that seating, that connection is not very passive, it becomes active, meaning it doesn't go fully all the way in. So then you will get problems like fracture, screw loosening, implant failure if the abutment or the crown is not fully seating into the implant because there is some space again left here. अगर ये पूरा सीट नहीं हुआ तो स्पेस रह जाएगा, स्पेस रह जाएगा तो बैक्टीरिया आ जाएगा. Okay, so I think one more concept I will take and I will end this lecture, then we will continue in the next Sunday. Another what I want to state is implant platform can be wide and can be narrow, same like abutment platform also can be wider or can be narrower. So here what you see on the left side, the implant abutment platform is matched. Okay, the size of the implant and the size of the abutment is same. That's why there is no crease, there is no groove here. You can't see where the abutment and the implant is meeting together. So this is known as an implant matched platform or platform matched prosthesis. Now, sometimes there was a researcher who thought, okay, let me see what happens when we place a narrower abutment on top of a wider implant. So what he found was that there was much less bone resorption in cases where the abutment was slightly narrow. So this concept came because he wanted to he actually did not have the correct size of the abutment in the inventory, so he placed a Nobel implant of size 5 millimeters, but he had only a 4 millimeter abutment. So he placed the 4 millimeter abutment, then he tightened it, sent the patient. After 2 years when he recalled the patient, he saw that that particular implant did not show much bone resorption than his other implants. So why that happened? Because the abutment became more inside than the implant. So the connection came horizontally inside. When it came horizontally inside, it again went away from the bone. Okay, so in tissue level implants we studied the connection goes vertically up, so it goes away from the bone, so bone loss is less. Now another concept I'm explaining where the abutment goes inside, so horizontally there is less bone resorption. So here again the bacteria will not get that much accumulated as it will in an implant platform matched abutment. So this is the more preferred design in nowadays where we want to use. This is available in most of the companies except the very basic companies like the Aidin, Bioline, Norris और very very basic like जो internal hex वाले components है which are very cheap, उनमें ये वाला structure नहीं available है, only platform match abutments are available. But in higher companies like Ostem, like Dio, like Strawman, like Nobel, like Cowell Medi, like BioHorizon, all these abutments are having platform switch capabilities where the abutment is slightly narrower than the implant platform. Okay, so now I'm going to end this. I want you to ask as many questions as possible in this so that we are clear. Okay.
Sir, may I?
Yes, sir.
Sir, so we have a different types of hacks and different types of design for the connector as you explained. So in case if we have referred up got an OPD जिनके अंदर अपॉइंटमेंट लेट्स से रिमूव हो गया या फ्रैक्चर हो गया है, तो हाउ डू वी आइडेंटिफाई कि कौन सा इम्प्लांट डाला होगा इफ पेशेंट डजंट नो?
Very nice. Very, very true. We cannot identify just on the basis of what patient says. We have to backtrack from the uh, person who has done the
Previous
implant,
dentist.
previous dentist, and there is a site which is known as whatisthatImplant.com. Okay, साइट का नाम है whatimplantisthat.com. वहां पे आप जाओ, पेशेंट का एक आईओपीए ले लो, वो आईओपीए आप कंपेयर करने का ट्राई करो with the with the different IOPAs and structures which are available on that website. You will try to have like filter out करो, 2-3 कंपनीज फिल्टर आउट करने का कोशिश करो. Then you can ask the company reps कि ये वाला, मतलब वो 3-4 कंपनीज हो गए ना, ऑलमोस्ट 500 इम्प्लांट कंपनीज आर एग्जिस्टेंट इन द वर्ल्ड टुडे. एटलीस्ट 500 में से 5 तो भी फिल्टर आउट करना चाहिए. देन वो 5 फिल्टर आउट करने के बाद यू कॉन्टैक्ट देयर 5 मेडिकल रिप्रेजेंटेटिव्स एंड आस्क देयर KOLs, की ओपिनियन लीडर्स, कि ये कौन सा लग रहा है, आपके कंपनी का लग रहा है कि नहीं लग रहा है. वहां से यू विल कम टू 2 or 3 मैक्सिमम. ओके, देन यू ऑर्डर देयर इम्प्लांट ड्राइवर, एक डेमो के लिए दे देंगे कोई भी कंपनी. देन यू ओपन द फ्लैप एंड चेक द इम्प्लांट ड्राइवर कितना अच्छे से फिट हो रहा है एंड टेक एन एक्सरे. जिसका कंपनी का इम्प्लांट ड्राइवर बेस्ट फिट हो रहा है इम्प्लांट का, वही इम्प्लांट का सब कुछ यूज कर लेना. ठीक है, दिस इज वन वे. ओके, वन वे. सेकेंड वे इज टू take a light body impression of the internal component of the implant. So क्या करना है आपको, ये वाले पार्ट का एक पिक्चर लेना है और इसमें लाइट बॉडी डालना है गन से. जैसे हम पोस्ट करने, वो कास्ट पोस्ट करने के लिए डालते हैं ना रूट के अंदर.
हाँ सर.
वैसे कास्ट पोस्ट करते हैं, वैसे आप लाइट बॉडी फ्लो करो और उसका एक इंप्रेशन लेके आप वो लैब वाले को भेजो एंड लैब वाले को बोलो इसका एक मॉडल पोर करे. वो मॉडल पोर करेंगे, फिर वो क्या करेंगे, अपने लाइब्रेरी, जो इम्प्लांट डिजिटल लाइब्रेरी रहता है उसके साथ मैच करने का ट्राई करेंगे. सो उससे भी आपको थोड़ा आइडिया आ जाएगा कि अंदर का कनेक्शन कैसा है.
Okay, sir. And one more thing was that sir, you explained about the different concept of platform. One was the equivalent to the size of an implant, and one was a little constricted one, around 1 mm.
Yes.
Yes, sir. This one. So doesn't it create the pressure on that junction of the implant and abutment because the size is slightly less in structure?
No, it doesn't create. In fact, it helps. कि थोड़ा सा अंदर की तरफ है ना, so it helps the bone also, it helps the soft tissue also to grow here and get attached fully.
Okay, sir. So what should we prefer in the normal case scenario, the left one or the right one?
We want to prefer the left, this one, right one, platform twist, but they are expensive.
Okay.
So whichever case, like जैसे मैंने बताया, बायो होराइजन है, स्ट्रॉमेन है, डियो है, ऑस्टेम है, इन सब में आता है. बट द इम्प्लांट कॉस्ट फॉर दोज इम्प्लांट्स विल स्टार्ट फ्रॉम 5,000, 7,000, 9,000, ऐसे कॉस्ट के तरफ जाता है इम्प्लांट का रेंज. ओके, एंड दोज विच आर स्टिल यूजिंग द ओल्डर टेक्नोलॉजी, ऑब्वियसली दे विल बी चीपर.
Thank you.
Sir, one ideal scenario in which we have to use only a tissue level implant and we cannot use the bone level implant.
ऐसा कोई सिनेरियो नहीं है.
No, we can practice only bone level implant की tissue level implant भी सीखना जरूरी है.
If you have only bone level implant in your implant practice throughout your life, you are not losing on anything.
Okay.
कोई प्रॉब्लम नहीं आएगा. बट some very specific scenarios, I'll state one scenario. For example, patient has come to you saying that I want to do Straumann implant only.
Okay.
And Straumann implant does not have, and you look at the CBCT and you see patient का bone सिर्फ 8 mm का है या 6 mm का है.
Okay.
ठीक है, 6 mm का है, चलो मान लेते हैं 6 mm का बोन है. तो आप स्ट्रॉमैन वाले के पास जाते हो, बोलते हो आपके पास 6 mm का इम्प्लांट है क्या. वो बोलेगी नहीं हमारे पास 6 mm का इम्प्लांट है नहीं, पेशेंट बोलता है आपको सिर्फ स्ट्रॉमन इम्प्लांट ही चाहिए, तो देन व्हाट विल यू डू? स्ट्रॉमन हैज अ 8 mm इम्प्लांट विच इज अ टिश्यू लेवल इम्प्लांट। ओके,
Got it.
तो 8 mm कहाँ से कैलकुलेट होता है? यहां से लेके यहां तक, फ्रॉम टॉप ऑफ द इम्प्लांट टू द बॉटम। उसमें से 2 mm you will put in the gingiva, rest 6 mm of bone you have, you will place in the bone. So you have total 8 mm implant, but 6 mm of bone में 6 mm का rough surface डाल दिया। Okay, so that works well. So you have done a Straumann implant and you have made the best use of your knowledge by understanding कौन सा technology वहां पे useful होगा।
Okay.
Okay, हाँ, Norris has a 6 mm implant. So if you can tell the patient कि नहीं मैं I will prefer to do Norris over here, then that's also fine. If it's an international patient, I don't think most of the time they don't get convinced. उनके मन में रहता है I want to do Nobel or I want to do Straumann. So both Nobel and Straumann have these tissue level implants.
Okay. Okay.
So, sir, in in which situations does the bone level implant have like higher risk of the bone loss, like the crestal bone loss? Is there any ideal or specific situation which we should take under consideration before planning if we are doing a bone level implant or a tissue level?
See, ideally in posteriors, where you have good amount of the bone, try to place a tissue level implant. Okay,
Okay,
because
sir.
because there are very clear advantages in posterior. These implants have a collar where the gums will get attached. You don't have to again and again remove this, so your gum attachment is not disturbing, and the micro gap of the abutment and the implant is away from the bone, so आपका bone loss भी कम होता है। Okay,
Okay, sir.
but how many implant companies will you keep? How many inventory will you keep? How much will you invest in the components of all these implants? वो भी एक question है। So
Yes, sir.
implant tissue level and implant bone level same company के different components आते हैं। So आपको
Okay.
bone level of Straumann will fit in a different abutment, a different impression post, different scan body, different analog, different former. Tissue
Yes, sir.
level will fit in everything different.
Okay, sir.
इसका सर्जिकल किट अलग है, इसका सर्जिकल किट अलग है। Okay,
Okay,
so
correct,
if
sir.
you want to invest in Strawman, then 5 लाख रुपीस का पहला पैकेज ये, 5 लाख का दूसरा पैकेज ये।
Okay.
ठीक है, so that's how we have to understand क्या करना चाहिए।
Yes, sir. Okay. Sir, also, how can we just check the how does the biologic width alter in the tissue and the bone level, sir?
हाँ,
Is there?
very nice, true, spoken like a true periodontist. So biological width is more preserved in tissue level implants. When we are doing the surgical part now, I will tell about how to maintain biological width around the implants. So what we do, biological width in implants is basically the tissue which is lying above the bone. Okay, so
Yes,
sometimes
sir.
we have patients who are having very thin ridge. We have having very thin soft tissue, very thin biotype. Okay,
Yes, sir.
so in those patients, we directly don't go and place the implant even if the bone is good. We want to create a shelf, a platform, and we want to reduce the bone height so that we get more tissue surface. Thickness थोड़ा ज़्यादा आना चाहिए. So
Yes.
what studies have shown are that if this thickness of the soft tissue is more than 3.5 mm, okay, it is beneficial when you place the implant. It is beneficial.
Yes, sir.
एंड अगर ये सिर्फ थिकनेस 2 mm है और आपने यहाँ पे बोन क्रेस्ट के ऊपर इम्प्लांट डाल दिया है, व्हाट विल हैपन ओवर 2-3 years इज द बोन विल रिजॉर्ब बाय 1.5 mm till this
Yes.
thickness becomes 3.5 mm. So यहाँ पे आपको बोन लॉस मिलेगा।
Yes, sir.
ओके, सो दैट्स वाई पहले ही प्लेटफॉर्म रिड्यूस करके बोन का, फिर आप थोड़ा और डीप डाल दो इम्प्लांट ताकि आपको ऊपर का थिकनेस ज्यादा मिल जाए।
Okay. Okay. Thank you, sir.
Sir, how different will be the stability graph in a patient wherein we have done bone grafting? ये जो आपने बताया वो आइडियल सिचुएशन था मतलब। वो बोन ग्राफ्टिंग वाले केस में कैसा सिनेरियो रहेगा?
बोन ग्राफ्टिंग यू मीन टू से कि हमने इमीडिएट इम्प्लांट किया है कि हमने डिलेड मतलब एक्सट्रैक्शन के बाद
We
किया
have
है?
we have placed the implant and bone graft was placed because maybe 2 or 3 screws were exposed.
हाँ
So
ओके
वहाँ पे bone grafting करके
हाँ
suture किया.
हाँ इट विल नॉट वेरी बिकॉज प्राइमरी स्टेबिलिटी आपका कहाँ से आता है? प्राइमरी स्टेबिलिटी आपका ही एपेक्स से आता है।
Apex.
तो
Yes.
आपको यहाँ पे अगर थोड़ा बोन लॉस है तो आपके
Okay.
प्राइमरी स्टेबिलिटी हीलिंग इससे ज्यादा फर्क नहीं पड़ेगा। बट एक चीज होगा कि इफ यू हैव ग्राफ्टेड देन यू माइट वांट टू वेट अ लिटिल लॉन्गर
Okay.
बिकॉज ग्राफ्ट का फिर वो वहां पे क्या होता है, व्हेन द ग्राफ्ट इज देयर ग्राफ्ट हैज टू रिजॉर्ब, उसका भी एक टाइमलाइन होगा। So if you have put a
Okay.
autogenous graft, it will resorb in 1.5 2 months. If you have put a xenograft, it will resorb in 10 years. If you have put something like a alloplast like Nova Bone, it will resorb in 3 months. So आपको फिर उतना वेट करना है before you actually do the second stage or the आगे का procedure till the graft is completely turned into bone.
Okay.
Sir, in tissue level implants also, we directly place the gingival former, or how to be proceed in that?
Placing gingival former or not on the day of the surgery. Just give me a moment. Just one moment.
Yeah,
अब
sir, sure.
इसका फोन उठाओ ना, ड्राइवर का फोन है, उसको बोल दो ना आ जाए 4102 में। क्या सो टिश्यू लेवल इम्प्लांट्स में फॉर्मर लगाना है या नहीं, बोन लेवल इम्प्लांट्स में फॉर्मर लगाना है या नहीं लगाना है, एक्चुअली डिपेंड्स ऑन थिकनेस ऑफ द जिंजाइवा एंड द प्राइमरी स्टेबिलिटी विच यू हैव गॉट। See, you don't want your implants to be exposed in the oral cavity unless and until they are stable. बिकॉज अगर बहुत लूज इम्प्लांट है तो डालना ही नहीं है, निकाल ही देना है। थोड़ा सा लूज है, लाइक यू हैव गॉट टॉर्क ऑफ 10 और 15, यू कैन स्टिल एक्सपेक्ट स्टेबिलिटी टू टेक ओवर विद टाइम, बट यू हैव टू सबमर्ज इट एंड यू हैव टू फुल्ली क्लोज द फ्लैप। फॉर्मर नहीं लगाना है, अदरवाइज व्हाट विल हैपन, जो टंग प्रेशर है, चीक प्रेशर है, उससे भी तो माइक्रो मूवमेंट्स इंड्यूस होंगे थोड़े। तो माइक्रो मूवमेंट्स
Yes,
की वजह से जो प्राइमरी स्टेबिलिटी ऑलरेडी कम था वो और खराब हो जाएगा।
yes, sir.
ओके बट अगर अच्छा प्राइमरी स्टेबिलिटी है लाइक 30 35 40 एंड यू हैव एवरीथिंग इज गुड, ओरल हाइजीन इज गुड एंड पेशेंट इज सेंसिबल इनफ नॉट टू च्यू फ्रॉम दैट हीलिंग एबटमेंट ओनली, देन यू प्लेस अ हीलिंग एबटमेंट एंड विच इज फ्लश विद द जिंजाइवा। ज्यादा ऊंचा नहीं होना चाहिए, इट शुड बी एट द लेवल और मैक्सिमम 1 mm above the gingiva, not like very tall, so that ना टंग प्रेशर चीक प्रेशर उसको भी नहीं आए। आई एम टॉकिंग एवरीथिंग अबाउट पोस्टीरियर, एंटीरियर में दिस इज अ डिफरेंट कॉन्सेप्ट।
Okay, sir.
ओके
And yes, yes, sir. Go ahead.
टिश्यू
You are
लेवल
explaining,
में
sir.
टिश्यू लेवल में क्या होता है, यू हैव टू चेक द थिकनेस ऑफ द टिश्यूज। सो इफ द थिकनेस ऑफ द टिश्यू इज more than this collar, okay, if it is more than this
Yes.
collar then you have to place a former. If it is not more than this collar, it is after placing the implant, after doing the suturing, आपको ऐसा दिख रहा है कि this is almost coming till the same level, ठीक है, then you don't
Okay.
have to place the former, you can just do the cover screw and leave it like that. Okay.
Then after 2 months or 3 months, the remaining time we will proceed with the other things.
हाँ, we can proceed. See, I always try to respect the biological width in tooth and in implants. So मैं जब भी implants करता हूँ, if the bone allows me, I always do the crestal reduction. I will put the implant slightly lower, lesser. तो फिर automatically 3.5 mm of soft tissue आ ही जाता है एंड उसके ऊपर फिर फॉर्मर लगाना पड़ता है।
Okay.
ओके बट वो आप कब लगाओगे डिपेंड्स ऑन द प्राइमरी स्टेबिलिटी। टिश्यू लेवल में भी डिपेंड्स ऑन प्राइमरी स्टेबिलिटी, बोन लेवल में भी डिपेंड्स ऑन प्राइमरी स्टेबिलिटी।
Okay, sir. And after the extraction of a, let's say, grossly decayed tooth or something, and if we have placed the immediate implant in the same sitting, so shall we get the good primary stability or not, or what?
हाँ, यू कैन गेट गुड प्राइमरी स्टेबिलिटी, वी हैव डन सो मेनी केसेस, क्लिनिक में चलते रहते हैं जिसमें बहुत अच्छा प्राइमरी स्टेबिलिटी आ जाता है विद इन लाइक आफ्टर एक्सट्रैक्शन ऑल्सो।
But sir, generally molars have more roots. What my question is that molars have more roots,
हाँ.
and we place a conical implant screw-shaped root.
Hmm.
So like there are more defect in the bone in the form of we have just extracted the tooth
Hmm.
and the cavity is a little hollow.
Hmm.
So from that point of view, I'm asking if that it is more stable or not.
No, it can be stable if you have done the correct drilling protocol for that bone type, for that implant type.
Okay.
If you have if you are able to engage the interradicular bone, and if you have chosen
Okay.
the correct size of the implant, again you can get good primary stability. उसमें भी you can place, in fact we prefer to place a customized healing abutment so that we can close the socket fully.
Okay.
Okay. So there are techniques. We'll learn about them slowly as you progress in your implant journey. You will keep attending more
Okay.
workshops, more courses. You will keep learning all these concepts.
Okay, sir. Thank you.
Sir, a torque of 25 can we consider as a good primary stability, or it should be 30 and above?
See, it is good 25 above. See, if it is a more active implant, if it is an implant which is like Ostem, which you are very confident about the surface of the implant कि वो integrate अच्छा हो जाता है, उसमें ऐसा कोई problem नहीं आता है, your sterilization is good, everything else is stable, you can consider 25 to 30 more than, like it's a good torque. Less than 25 is very risky.
Okay.
Okay, risky in the sense to place abutment also, to place the
Yes,
healing
yes.
abutment also. That
Healing
in
abutment.
those cases then prefer के पूरा submerge करके उसको बंद करके छोड़ दो, हो जाएगा सब ठीक.
Okay.
Yes, any other questions or shall we wrap up? I'm just running through the slides so that any of you have any questions on the topics covered previously, you can ask.
Sir,
Yes.
like for the next session and for the upcoming surgery sessions, do you recommend reading something or going through some videos before we come for the next session?
Not really required, ma'am. Most of the basic topics I'm going to cover.
Okay.
Okay. This whole workshop is designed so that you can get an introduction to the implant dentistry and you can place your first implant in your clinic. You can start doing implants on a regular basis. बट इम्प्लांट टॉपिक में भी जैसे रूट कैनाल्स में होता है, पहले आप you understand how to do anteriors, then you do posteriors, then you start doing bypass, then you start doing ledge management, instrument removal under working microscope. So all these topics cannot be taught in 1 day or 3 days or 5 days. It's a journey. So don't start your implant journey by doing a immediate molar implant. Do it with a delayed implant placement in a healthy bone. Understand the concepts which are basic, which are applied to one single implant placement. Then after this course, you do another course of some. I'll recommend इसका पूरा implant pathway, career pathway. You join some memberships. You do ICOI or ISOI courses. You attend other mentors who will teach you about in depth अबाउट मोलार इम्प्लांट प्लेसमेंट. सो एक स्पेशल सेशन सिर्फ मोलार के लिए कर लो, एक सिर्फ एंटीरियर के लिए कर लो, उसके 2-3 महीने के बाद ग्राफ्टिंग के लिए कर लो, उसके बाद साइनस लिफ्ट के लिए कर लो. सो ये जर्नी ऐसे ऐसे चलता रहेगा.
Okay. Okay. Thank you.
ठीक है. Okay, we'll wrap up and we will meet in the next appointment in the next time. I hope I have made everything clear and I hope that I have arised a lot of questions within you so that you can keep asking yourself, keep having that curiosity and passion to learn more. Okay.